Hi, Dr. Mora here, bringing you Mora cutting edge orthopedic surgery, left shoulder arthroscopy, definite rotator cuff tear. That's what we're at right now. That's what this crescent shaped opening is right over here. Okay, greater tuberosity, rotator cuff tear. I'm on top of the rotator cuff. The acromion bone is above, and the deltoid would be to my left. Okay, so we are inside the shoulder, and I knew this patient had a rotator cuff tear. There was also a small calcification on the x-ray, and that's what we're looking at now. I just wanted to show you what calcific tendinitis looks like. It looks like that. It looks like toothpaste. You can see that right there. Let me get this out of the way for a second. Oops, we're gonna get that later. So I'm going to decompress this calcification right there. You see that little sort of blister right there? That is, there's something in there because normally the cuff doesn't look like this. So what I'm going to do is kind of go like this, go like that. Look at that. Show you, look. Stay right there. And then just put a bigger tool that allows me to compress it a little bit better. And then go like this. See that? Calcific tendinitis. Now, if you do this in the office, you can certainly hit it with a needle in the office if you have an ultrasound. That's for sure. But the problem is, what are you going to do with all this calcium that goes floating around the joint right there? See, that will irritate the heck out of the joint. Now, once again, I'm not doing this surgery to decompress the calcium. I'm doing the surgery to fix this rotator cuff tear. This is something that was in the shoulder. I'm not going to leave it here because it irritates the joint, and it destroys and it'll destroy the rotator cuff. So I'm going to try to just squeeze it out, and then repair the rotator cuff. Okay. This hurts. This is why this patient's pain was greater than I expect with a rotator cuff. Calcific tendinitis is extremely painful. When one of these little pieces of calcium breaks off, it does this. It fills the joint with snow, or the subacromial space with snow. It's extremely inflammatory. I tell patients it's like battery acid. So very painful. Eventually the shoulder comes down, and then the calcium gets re-encapsulated. So many times people don't need surgery for calcific tendinitis because it'll cool down on its own. But when it does break apart, that's what it looks like. Let me go ahead and shave this. There it is. That's the infraspinatus tendon right there, and towards the back of the rotator cuff. I'm going to go in here with this rotor-rooter type of device, or the shaver type of device, and suck out those fragments. See? I'm going to suck them all out because otherwise it's going to irritate the shoulder after surgery. Like this. It's very vascular. Why is it very vascular? Because the body was responding to it, and it was getting irritated. There's some more right there. And that was the hole or the cocoon, or the hole, I guess you can call it, where that calcium was at. And I think I got it all out. Yeah. See, it was like a little pocket. And that's why it had formed what looked like a little blister in the rotator cuff. Let me clean this up a teeny bit so we can see it a little bit better. Stop the bleeding here so we can see a little bit better what's going on. I want to make sure there's nothing else. Infraspinatus. Hang on, wait a minute. Let's go over here. There might be some more. Yeah, look at that. See? I think It's like, honestly, it's like popping a pimple. I'll be honest with you, that's what it feels like I'm doing here. But it's actually important to get it all out because it's very irritating to the joint. So I'm going to continue to do my work here to get rid of this calcific tendinitis deposit, and then I'm going to fix this patient's rotator cuff tear. But I can tell you right now, like just removing this very painful deposit of calcium is going to make her feel better. Dr. Mora here at Restore Fusion Spine Center in Orange, here to help whenever you're ready, bringing you more cutting edge orthopedic surgery. Thank you, bye.